Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about why does the breast need to be compressed? Why we need the compression in the breast cancer detection? Okay, compression holds the breast in the place to minimize blurring of X-ray images that can be caused by the patient motion. Why we need the compression is that once we use the compression, if the patient moves aside also, we need not bother about that, and it will not affect the images. If the compression is not needed, if not done, the images can be of blur. We can see the images right. Without compression, your X-ray would appear. With compression, how the X-ray will appear? We have the difference, right? For this difference to get a clear X-ray image, we are going for compression. Okay. Also, compression evens out the shape of the breast so that the X-ray can travel through a shorter path to reach the detector. Okay, since the breast is compressed, okay, the X-ray, the compressed, it evens the shape of the breast. The shape of the breast can be even in all the sides, and X-rays can travel through the shorter path. Once that is compressed, the X-ray can reach in a very shorter path and reach the detector. This reduces the radiation dose and improves the quality of X-ray images. This reduces the X-ray dosage, radiation dose, and improves the quality of the images. Finally, compression allows all the tissues to be visualized in a single plane so that small abnormalities are less likely to be obscured by overlying breast tissues. Okay, while the compression is undergone, all the tissues to be visualized in a single plane. A complete breast tissues can be visualized in a single plane so that small abnormalities are less likely to be obscured by overlying breast tissues. Small tissues can also be identified once if the breast is compressed. The overlying tissues, we have many overlying tissues in the breast, right? Each and every tissue can be identified. Okay, why the compression we are going is that one is to minimize the blurring of image. Okay, minimize the blurring of image, and the radiation dosage can be reduced and it easily reaches the detector. The radiation, the X-ray can travel through the shorter path and it can reach the detector very shortly, and it reduces the radiation dosage and improves the quality of X-rays also, X-ray images. Okay, next, third one is, it is compressed because all the tissues in the breast can be visualized in a single plane. We cannot have many different types of planes for visualizing each tissues, right? Will all the tissues can be visualized in a single plane, and a small abnormalities in each tissues can also be observed very clearly. This is why the breast needed to be compressed in a mammographic procedure. Okay. Next is, what will the result look like once you have a cancer? How does it look like? A mammogram shows a small cancerous lesions. You can see in the image that will have a small red area has been marked over there. It will showing as a small cancerous lesions. A radiologist will carefully examine a mammogram to reach for higher density region or areas of unusual configuration that looks different from normal tissues, like cancerous tumors or non-cancerous masses called complex cysts or begin tumors. Either it may be a cancerous tumor or it may be a non-cancerous masses. It can masses in the sense we can have a tissue growth also over there, right, called begin tumors or a complex cysts. Okay, radiologist looks at the size, shape and contrast of an abnormal region, all of which can indicate the possibility of a malignancies. Okay, the radiologist will identify by using the shape, size and the contrast of the abnormal region. They will identify whether it is a cancer cell or any other non-cancer cell, cancerous masses. They also look for tiny bits of calcium called microcalcification. Okay, microcalcification, while usually begins sites of microcalcification may occasionally signal the presence of specific type of cancers. This bit of calcium, right, bit of calcium, which is also called as microcalcification, this begins to form as a typical special type of cancers. This is a initial stage of cancer formation, cancer cell formation. This can also be identified. If a mammogram shows one or more suspicious region that are not definitive for cancer, the radiologist may order additional mammogram views with or without additional magnification or compression, or they may order a biopsy. Okay, once the mammogram results shows many suspicious regions, the radiologist can undergo for a additional mammogram views or with or without magnification, additional magnification or a compression of the additional magnification or compression, or they may order for an biopsy also. Another alternative may be referral imaging study. Okay, another alternative method can also be used, another type of non-invasive imaging study. This can also be identified. Once the result, how the results looks like will be of these kind of things. If we have a mammogram, whether if you have a cancer cell, it will show the small cancer lesions, or else we can go for another type of procedures, whether it is to identify whether it is a cancer cell or not. Thank you.